So the main symptoms of dry eye typically are burny, red, itchy. Just people would just say the eyes are very dry. However, there's a lot of dry eye symptoms on which are quite so typical when people describe them, which can be fluctuations in vision, uncomfortable eyes, heavy eyelids, or just something not feeling quite right. But the rest of the eye health is completely normal and they don't need vision correction, or the vision correction is absolutely spot on. Dry eyes does lead to a lot of symptoms which are not typically worded very well anymore. So the main trend we're seeing with dry eyes lifestyle and habit changes is obviously screen use. And since COVID, obviously everyone's been working with screens a lot more. That constant staring at the screen, whether it's a digital phone or looking at a desktop PC, you're blinking less often than you ought to, you're moving a lot less often as you ought to. And those subtle changes are really, really increasing the dry eye epidemic, as we call it. Absolutely, dry eyes can be rooted by other causes of the body. We often find autoimmune disorders, body inflammation creates a lot of dry eyes. You've got to remember, dry eyes by definition is really an inflammatory condition. So anything which is inflamed will cause dry eyes. We're also seeing a rise number of people who are on medication which can cause dry eyes. And it can also be young teenagers who have been on acne medication, for example, Accutane, which causes dry eyes later on. Other body changes, we'll often find dry eyes more common in women than men, which is probably due to hormonal changes. So it's quite important when we look for dry eye causes, we do a full thorough workup, which we do during our eye examinations here. So treatment for dry eye is really about dampening down the symptoms here. We here at Safari and Son, we adopt a three-stage process really. One, the home remedies. So there's things that patients can do at home to reduce dry eye symptoms, which can be changing habits, so taking more breaks from their screen, better ventilated places to work in. Sometimes we will give patients a warm eye bag or an electric wand to reduce something called gland dysfunction, which is the primary cause of dry eyes. And there's multiple amount of eye drops here on the market, which sort of mask the symptoms of dry eyes. Unfortunately, many of the drops on the supermarket or chemist shelves are just not suitable. So you've got to pick the right drop, which we can advise you on. You've got to remember the home remedies have a low efficiency and effectivity, so they're just covering the problem up here. The second approach we'll offer our patient is medical management, so really medical eye drops here. As I said, dry eyes is an inflammatory condition, so we'll be looking to add anti-inflammatory eye drops to the eyes just for short periods of time, because we can't keep people on steroids for too long because it can cause secondary problems here. And the third option really, and something that we really excel at here, is providing in-practice treatments here. So really the mainstay of treatment is dampening down inflammation, which we do using intense pulse light treatment. We here have the only FDA cleared IPL machine known as the Luminous. Right behind me, you're going to see we've got a red light mask here as well, which sits on people's faces, which creates the right amount of temperature to open up the oil glands. We also offer something very, very unique. I think there's only a few of us in the UK that offer something called probing, which is when we use a very small device just to open up the oil glands here very well. And also we can clean the eyelids. So blepharitis is a common term people will be told they have. Unfortunately, cleaning eyelids at home is not very effective like cleaning your teeth. We clean it for you here using the right tools, and that will keep dry eyes right down to a minimum. And something new and exciting coming early part of 2024 is amniotic membrane, which is very, very unique, whereby we use a membrane taken from a placenta of a lady with a C-section, we implant it on the eye, and it's got natural healing properties for the cornea. And there's some really exciting developments in dry eye, and we are always at the forefront of it.